Hello everyone. Today we are going to discuss another 10 topics for the NEET MDS preparation. These topics are selected from the previous year questions. So let's start. Our first case involves a patient with acute kidney failure. On a blood film, we observe schistocytosis or fragmented red blood cells and thrombocytopenia. This combination is the hallmark signature of microangiopathic hemolytic anemia, abbreviated as MAHA. When paired with acute kidney failure, it points to a thrombotic microangiopathy TMA spectrum disorder. Most notably, thrombotic thrombocytopenic purpura. Now, it is important to distinguish this from multiple myeloma, which would show Rollux formation or Tumor Lysis syndrome, which is characterized by severe electrolyte imbalances rather than schistocytes. Then coming on to the next topic, which is syphilis. When monitoring a patient after syphilis treatment, the choice of test is critical. The correct tool is the VDRL, a non-treponemal test. Unlike treponemal tests like TPPA or FTA-ABS, which often stay positive for life, VDRL titers decline following successful treatment. A four-fold drop in titer is the clinical standard to confirm that the infection is no longer active. Then moving on to the next topic, which is raloxifene. Raloxifene therapy is a selective estrogen receptor modulator used to treat post-menopausal osteoporosis. It acts as an estrogen agonist in bone tissue to increase density and reduce fracture risk, while acting as an antagonist in breast tissue to reduce cancer risk. This distinguishes it from treatments for renal osteodystrophy, which focus on phosphate binders and vitamin D analogs. By mimicking the estrogen, raloxifene slows the osteoclast resorption and it prevents the post-menopausal osteoporosis. Why not renal osteodystrophy or chronic renal failure? Renal conditions involve complex hyperparathyroidism and high phosphate, managed with phosphate binders and calcitriol, not SERMs. Chronic osteomyelitis require surgical debridement and IV antibiotics. Now coming to the intramuscular injections, anatomical safety mapping. In clinical procedures, the superolateral quadrant of the gluteus muscle is the classic preferred site for intramuscular injections to avoid the sciatic nerve and major gluteal arteries. However, it is important to note that modern standards now prioritize the ventrogluteal site at the lateral hip, as it offers a superior safety profile and virtually eliminates the risk of nerve injury. You can see in the diagram the gluteus muscle is hypothetically demarcated and marked into 4 quadrants. Next topic is orthodontic mixed dentition analysis, the radiographic exception. In orthodontics, we have various methods to predict the size of unerupted teeth. The Huckaba method is unique because measurement of the incisors is not required. Instead, it uses a radiographic scaling formula to calculate the actual width of a permanent tooth based on its primary precursor, mathematically compensating for any X-ray distortion. Now we have a another topic, biomechanics of a couple. So we look at the clinical measurements. The diagram shows a moment value of 1200 with rotational arrows curving at left at the incisal edge and right at the root apex. The movement of the couple is 1200 gram/mm anti-clockwise. Then moving on to the next topic, it is primary herpetic gingivostomatitis. In pediatrics, a 3-year-old child presenting with a high fever, lymphadenopathy and widespread painful oral vesicles is a textbook case of primary herpetic gingivostomatitis. This is the clinical manifestation of a child's first exposure to herpes simplex virus 1. It is distinguishable from herpes zoster, which is typically unilateral, and ANUG, which presents with necrotic papillae rather than widespread vesicles. Turning to periodontal health, the organism primarily responsible for pregnancy gingivitis is Prevotella intermedia. This bacterium has the unique ability to substitute systemic progesterone for vitamin K as a growth factor. This leads to a massive population spike during the second and third trimesters, causing an exaggerated inflammatory response. These organisms, they concentrate within the gingival clavicular fluid. As a result, there is a massive population spike of Prevotella intermedia and T. denticola, driving the exaggerated inflammatory response. Next is dental calculus. When discussing mineral deposits, bruchite is the crystalline form of calcium phosphate, most commonly found in the anterior mandibular region. It is characteristic of young or early calculus, usually less than a few weeks old. It thrives behind the lower incisors due to the constant rapid influx of mineral-rich saliva from the submandibular and sublingual duct. So what are the other crystal forms? Hydroxyapatite, which is most common crystal form. Bruchite, seen mostly in new or early supragingival calculus. Octocalcium phosphate, seen in the supragingival calculus. Whitlockite, seen commonly in subgingival calculus. So early forms like bruchite and octocalcium phosphate mature into hydroxyapatite, and over a period of time they become magnesium whitlockite found in the subgingival calculus. Next, we'll discuss the standard eruption sequence for the maxillary arch. It is usually first molar, central incisor, lateral incisor, and then the canine. A key clinical takeaway is that in the maxilla, the canine erupts after the premolars, whereas in mandible it erupts before them. This delay makes maxillary canines highly susceptible to impaction if space is lost early. So you can see in the diagram, the first molar erupts, and then comes your central incisor, lateral incisor, both the premolars, and then erupts your canine. That's the reason for impaction, and this is routinely called as the maxillary lag. So this concludes our overview of these 10 critical clinical concepts, from identifying the blood film schistocytes to understanding the unique growth factors of Prevotella intermedia. These details are foundational for expert diagnosis, and they are crucially important during the preparation for NEET MDS, as these are taken from the previous year questions. So if you go through them, if you try to read more about it, you are going to solve questions properly, and your concepts will be rock solid. So all the best, and keep listening to these crucial 10 topics which are going to be discussed every day. All the best for your preparation. Thank you.